It's 2 a.m., so you're finally asleep. Your body is resting, your mind is quiet. But 7 hours later, you wake up feeling like you've been hit by a truck. Your neck is stiff, your back is screaming, your shoulders feel like concrete. And you think to yourself, I slept for 7 hours. Why do I feel worse than when I went to bed? Here's the truth. The problem isn't how long you slept. The problem is how you slept. Your sleeping position, the very way your body rests for those precious hours, could be sabotaging your spine, crushing your organs, cutting off circulation, and stealing the recovery your body desperately needs. And the worst part? Most people over 60 are sleeping in positions that are actively damaging their bodies night after night without even realizing it. We've been told that sleep is healing, that rest repairs the body. And that's true, but if you're sleeping in the wrong position, you're not healing. You're hurting yourself in slow motion. You might think your mattress is the problem, or your pillow, or your age. But what if I told you that the biggest threat to your morning energy, your joint health, and even your breathing capacity is simply the way you're lying down? This isn't just about waking up with a sore neck. This is about compressed nerves that cause numbness in your hands, restricted blood flow that leads to dizziness when you stand, spinal misalignment that creates chronic pain lasting all day long. Poor sleeping positions increase your risk of sleep apnea, acid reflux, and even cognitive decline due to reduced oxygen flow to the brain during sleep. For seniors, a bad sleeping position can mean the difference between waking up ready to enjoy your day and waking up feeling 10 years older than you actually are. But here's the good news, this is fixable. Today, I'm going to show you the 4 absolute worst sleeping positions that are quietly destroying your body, and then I'm going to give you 4 better positions to try instead. These aren't complicated. You don't need special equipment. You don't need an expensive mattress. You just need to understand what your body needs during those critical nighttime hours and how to give it proper support. By the end of this video, you'll know exactly which positions to avoid, why they're damaging your body, and which positions will help you wake up feeling genuinely rested and pain-free. You'll discover why one extremely popular position is called the spine wrecker by physical therapists. You'll learn which position restricts your breathing by up to 30%. And you'll find out the single best position for seniors that supports your spine, improves circulation, and reduces pressure on your joints all at the same time. Ready to finally wake up feeling good again? Let's fix this together. Now, before we dive into the specific positions, we need to understand what happens to your body during sleep and why position matters so much, especially after age 60. When you sleep, your body enters repair mode. Your muscles relax, your tissues regenerate, your spine decompresses after bearing your weight all day. But here's the critical part. For this repair process to work properly, your body needs to maintain what's called neutral spinal alignment. This means your head, neck, and spine should form a relatively straight line without excessive curves or twists. As we age, our spinal discs lose moisture and become thinner. The cartilage cushioning our joints wears down. Our muscles lose some of their supportive strength. This means the senior body is far less forgiving of poor positioning than a younger body. A 25-year-old might sleep twisted like a pretzel and wake up fine. A 65-year-old doing the same thing wakes up with pain that lasts for days. A 2021 study led by Dr. Raymond Chen published in the Journal of Clinical Sleep Medicine investigated this exact issue in adults over 60. The research team tracked 340 participants over 6 months, monitoring their sleeping positions and correlating them with reported pain levels and sleep quality. The results were staggering. Participants who slept in unsupported positions experienced 64% more morning stiffness and 47% more chronic pain compared to those using proper spinal alignment positions. The study concluded that sleeping position directly impacts musculoskeletal health in the senior population. Your sleeping position also affects your breathing. When your airway is compressed or restricted, oxygen flow decreases. This means your brain and organs don't get the oxygen they need for optimal repair. Poor breathing during sleep is linked to memory problems, increased inflammation, and cardiovascular stress. Circulation matters too. Certain positions compress blood vessels, reducing blood flow to your limbs. This causes that pins and needles sensation you might feel when you wake up. Over time, poor circulation during sleep can contribute to swelling, numbness, and even increased blood pressure. Now that you understand why position matters, let's talk about the 4 worst positions and why you need to stop using them tonight. Worst position number 4, stomach sleeping with your head turned. This position is a disaster for your neck and spine. When you sleep on your stomach, your head must turn to one side or the other so you can breathe. This forces your neck into extreme rotation for hours at a time. Imagine turning your head to look over your shoulder and holding that position for 7 hours straight. That's what you're doing to your cervical spine every single night. This position compresses the nerves in your neck, leading to numbness in your arms and hands. It flattens the natural curve of your lower back, creating lumbar strain. It also restricts your breathing because your rib cage can't expand fully when compressed against the mattress. Physical therapists call this the spine wrecker. If you're waking up with neck pain, shoulder tension, or tingling hands, and you sleep on your stomach, this is almost certainly why. Worst position number 3, the fetal position curled too tightly. Many seniors sleep curled up on their side with their knees pulled up toward their chest. While side sleeping can be good, this extreme curling creates major problems. When you curl too tightly, you restrict your diaphragm. Your lungs can't fully expand. A 2020 study from Stanford University found that overly curled sleeping positions reduce lung capacity by up to 30% during sleep. That's 30% less oxygen reaching your brain and body during the hours when repair should be happening. This position also puts strain on your lower back and hips. The excessive curve places pressure on your spinal discs. If you suffer from hip pain or sciatic nerve issues, this position makes them worse by compressing these already sensitive areas. Worst position number 2, sleeping on your back with no support. Sleeping flat on your back without any pillow under your knees might seem natural, but it creates a gap between your lower back and the mattress. This gap means your lumbar spine receives no support, forcing your back muscles to work all night long trying to stabilize your spine. You're supposed to be resting, but your back muscles are contracting for hours. This position also allows your tongue and soft palate to fall backward, partially blocking your airway. This is why people who sleep flat on their backs without support often snore and may develop or worsen sleep apnea. Reduced oxygen during sleep affects everything from your energy levels to your cognitive function. Worst position number 1, the twisted pretzel with one leg up. This is where you're on your side but with one leg bent up toward your chest and the other leg straight, with your torso slightly rotated. This position creates a spiraling twist through your entire spine. Your hips are rotated one direction while your shoulders face another. This twisting puts tremendous strain on your spinal discs and the ligaments that support your spine. Over time, this position can contribute to disc herniation, chronic lower back pain, and hip misalignment. Many people develop this position unconsciously while searching for comfort, but they're actually creating the very pain they're trying to avoid. Now I'm going to show you the 4 better positions in just a second. But first, I have a small favor to ask. If you're tired of waking up in pain, if you're ready to finally understand how sleep position affects your body, please click that subscribe button and give this video a like. Why? Not for my ego, but because there are millions of seniors out there waking up in pain every single day, thinking there's nothing they can do about it. When you like this video, YouTube shows it to them. You might help someone avoid years of unnecessary pain. So please hit that button. Done? Thank you. Now let's continue. This is a modified side sleeping position with proper support. Lie on your side with your knees slightly bent, not curled up tightly. Place a pillow between your knees. This single pillow keeps your hips, pelvis, and spine in proper alignment. Without it, your top leg drops down, pulling your spine out of alignment and creating strain. Make sure your head pillow fills the gap between your shoulder and head, keeping your neck neutral. Your ear, shoulder, and hip should form a relatively straight line. This position maintains spinal alignment, doesn't restrict breathing, and keeps pressure distributed evenly. Better position number 3, back sleeping with knee pillow. If you prefer sleeping on your back, place a pillow under your knees. This simple change makes a dramatic difference. The pillow maintains the natural curve of your lower back by preventing the gap I mentioned earlier. Your back muscles can finally relax completely. This position also keeps your airway more open than flat back sleeping, reducing snoring and sleep apnea risk. Make sure your head pillow isn't too thick. Your head should be in a neutral position, not pushed forward, which compresses your airway. Better position number 2, elevated upper body position. This position is particularly beneficial if you suffer from acid reflux, heart problems, or breathing difficulties. Use a wedge pillow or adjust your bed to elevate your upper body at a gentle incline, about 30 to 45 degrees. This elevation uses gravity to keep stomach acid down, reduces pressure on your heart, and makes breathing easier. You can sleep in this elevated position either on your back or on your left side. Sleeping on your left side specifically helps with digestion and reduces acid reflux because of how your stomach is positioned in your body. This is the ultimate position for seniors. Lie on your left side with a pillow between your knees, another pillow supporting your head, and optionally a small pillow hugged against your chest for arm support. Why the left side specifically? Your heart is slightly left of center. Sleeping on your left side allows gravity to help your cardiovascular system. It also improves digestion and reduces acid reflux better than right side sleeping. This position maintains perfect spinal alignment, doesn't restrict breathing, improves circulation, and supports all your joints properly. A 2022 study from Johns Hopkins found that seniors who consistently slept on their left side with proper support reported 52% improvement in sleep quality and morning pain reduction over an 8-week period. So let's recap your new sleeping strategy. You now know to avoid stomach sleeping with head rotation, overly curled fetal position, flat back sleeping without support, and the twisted pretzel position. Instead, you're going to try side sleeping with pillow between knees, back sleeping with knee pillow support, elevated upper body position for specific conditions, and the ultimate supported left side sleeping position. Listen, I know change is hard. You've probably slept the same way for decades. But your body is telling you something isn't working. The morning pain, the stiffness, the exhaustion despite sleeping. Your body is asking for better support. And here's what's amazing. Your body can adapt. Your sleep can improve. You can heal even over 60. You're not broken. You just need the right positioning. Imagine waking up tomorrow morning without that immediate groan when you try to sit up. Imagine feeling actually rested. Imagine moving through your day without that constant background ache. That is possible for you. Don't just watch this video and forget it. Try one of these better positions tonight. Pick the one that sounds most comfortable to you. Maybe start with the left side position with a pillow between your knees. See how you feel. Notice the difference. If you found this helpful, please remember to subscribe and share this video with a friend who might be struggling with the same issues. Let's help everyone get better sleep and wake up feeling good.